Okay, so we'll go ahead and get started. Good morning, everyone.
Good
If you could
morning.
please mute, that would be helpful so we can avoid some of the background noise. My name is Laura Riley. I'm the director of the Baltimore County Department of Aging, and it is my pleasure to welcome all of you here today. I bring greetings on behalf of our county executive, John Oshevsky Jr., who unfortunately wasn't able to join us this morning. However, I must say one of the very first conversations I had with him when he took office was the need for Baltimore County to acknowledge the large number of older adults and to plan and provide for them, which had been missing in some of the prior administrations. He immediately signed on for us to become an age-friendly community, and then also with the knowledge that we needed to tackle dementia-friendly Baltimore County as well. An acknowledgement of all the needs and to better support aging in our communities and also aging with dementia in our neighborhoods. So our first age-friendly report is now public on the Baltimore County website on our aging page. And we're poised now today to launch Dementia Friendly, which is a natural extension of our work that we did with all of our partners for Age Friendly. You'll be meeting our team members throughout the event, but I want to give special thanks to Emily Kearns, who put together today and who is our Dementia Friendly specialist. We're very fortunate to be able to have the funding to have someone dedicated 100% to this Dementia Friendly initiative. And I also want to thank Anne-Marie Reel, our caregiver program manager, and Michelle Mills, our division chief, who've been behind this as well. And Dana Brown, of course, is here, our deputy director, who without her, I could not do a thing for this department. I have to also give special acknowledgement to two special ladies who are on this call who, from the moment they entered Baltimore County Public Service, have been behind the Department of Aging, and that's Chief Melissa Hyatt, our police department chief, and Chief Joanne Runn, our fire department chief. Both ladies are with us today and showing their support for the effort that we're making, and we're working with both of them on a special training for first responders and how to respond to those who may have dementia in the community. So, ladies, I really appreciate both of your support, and I know that we're going to continue to do great things for Baltimore County. So, why are we even here today? We are inviting everyone who has a stake in Baltimore County's health and accessibility to join in this new initiative. Dementia Friendly Baltimore County by starting where you stand in whatever way you can. This is a community-based cross-sector model. So we welcome everyone from every corner of the county, including bankers, businesses, medical professionals, faith communities, persons living with dementia and their care partners, recreation and parks, and more. Every touch point in our day can become dementia friendly as long as we're knowledgeable about dementia and how to respond to consumers in our stores, our congregants in our faith communities, our neighbors, users of transportation and services, and so much more. So how do you get involved? Well, some ways to become involved include participating in our action leadership team, which you'll hear about at the end of today, becoming a certified dementia friend through a 1-hour session, becoming a presenter in your communities at home and at work, and signing up for our newsletter and more. So why should we care? Well, the facts are actually sobering. 6.2 million Americans are living with Alzheimer's disease. 11 million caregivers nationally support them. And in Maryland, more than 110,000 persons live with dementia, and 238,000 care partners support them. Dementia affects our families, our workplaces, and our entire community. We have an opportunity to come together to support the increasing numbers of individuals and households affected by dementia in our neighborhoods. By growing awareness about the signs and symptoms of dementia, we can respond to making our environment and our resources accessible. This way, those living with dementia and their care partners can remain in the community feeling welcomed and valued as long as possible. For more information, of course, you can go to our Dementia Friendly Baltimore County webpage on the County Department of Aging's website, or contact directly the coordinator, Emily Kearns, and we'll be providing all kinds of resources today for you as well. But we just wanted to kind of give you an overview of what this is all about, and we thank you all for definitely being here today. So I want to give turn us right over to our keynote speaker. But first, in order to do that, I want to introduce first a friend, a colleague, and a wonderful partner for Baltimore County Department of Aging. As soon as she heard that we were going to be launching Dementia Friendly, she was on the phone, and that person is Jane Marks. Jane is an RN and MS and is the Associate Director for the Johns Hopkins Geriatric Workforce Enhancement Program. That's a mouthful. It's a HRSA-funded program integrating geriatrics into primary care practices and promoting community outreach. Her work with the project extends across the state of Maryland, working with various healthcare systems and agencies. She provides and coordinates education for health professionals, caregivers, and regarding care for their older adults, and including the topic of dementia. Jane has always been a partner to us in all of our caregiving efforts. And with that, I want to turn it over to Jane, who will then introduce our keynote speaker. Jane, it's all yours.
Thank you, Laura. Thanks everyone for coming. It's my pleasure and honor to introduce our keynote speaker, Dr. Rabins. Dr. Rabins is a longtime resident of Baltimore County and an emeritus professor of psychiatry and medicine at the Johns Hopkins School of Medicine. He was the founding director of the Division of Geriatric Psychiatry and the first holder of the Richmond Family Chair in Alzheimer's disease and related disorders. He has published more than 300 articles and book chapters and is an author or co-author of 8 books, including The 36-Hour Day for Caregivers, Practical Dementia Care, The Way of Things, and Getting Old Without Getting Anxious. And it's my pleasure to also say that Dr. Rabins has been so supportive of our efforts throughout the years, providing education to not only health professionals, but to caregivers and the community in regards to dementia. Thank you so much, Dr. Rabins, for joining us today.
Thank you, Jane. Thanks for that kind introduction. And I'd also like to thank Ethel Rasmussen and Emily Kearns for asking me to participate. It's a real honor being a longtime Towson resident. I'm so glad to be involved in this launch of Dementia Friendly Baltimore County. I think it's a wonderful program, and it's so important for many of us. When I finished medical school in the dark ages, 1973, I would guess that none of the doctors and nurses that not only I had contact with that were in the medical school had ever heard of Alzheimer's disease, except for maybe a few specialists who knew about rare diseases. And yet today it'd be hard to find any adult who not only hadn't heard about the illness, but didn't know someone who was affected, often a loved one or family member. So that's an extraordinary change over about 50 years, less than 50 years. And so how did that happen? Well, it partly dates back to 1968, when some doctors in England found that people who had been called senile, in fact, mostly suffered from a brain disease that had been described more than 100 years before, called Alzheimer's disease. So this was a big change, because all of a sudden it said, people who become forgetful and unable to care for themselves when they get older, it's not just aging, it's not normal. They suffer from an illness. And I think that really changed how people thought about this condition. First, it spurred a tremendous research revolution. And we now know so much more about what's going on in the brain of the disease. We now have brain scans that can detect the abnormal proteins called beta amyloid and p-tau that seem to be related to the cause of the illness. We may be on the verge of having a blood test that'll help with diagnosis, and maybe, hopefully, in the next 5 or 10 years, effective medication. So that's dramatic, the huge changes. But equally dramatic has been what I'd like to call the care revolution, that we've learned how to help people who have the disease function better in life and how to have a better quality of life. And I think that too is a huge advance. And that's really what I want to focus on. And what I want to emphasize is the fact that in helping people who have Alzheimer's disease is very similar to helping people who have any other chronic illness. That is, our goal is to help maximize their use of their remaining abilities and to maximize their quality of life. So if someone's having trouble walking, the doctor and the team is going to evaluate the causes, and if there's something treatable, they'll treat that. But many people have persistent problems with walking.
Tell me how to turn the
And
captioning
those
on
people, we
on the
give a
WebEx.
cane, a walker, or a wheelchair. So somebody, you probably need to mute yourself if you're, here we go, thank you. So we determine what a person's need is, what can make them maximally functional, and then we provide them with that aid. The same thing is true for people who have Alzheimer's disease and other illnesses that cause dementia or impairments in the ability to think. One of the outcomes, I think, of recognizing that this is an illness or a group of diseases is that we've also started to listen more carefully to people who have these diseases. And when you talk with people who have memory trouble and other impairments in their ability to think and function, you find that many of them feel isolated, ignored. Many people report feeling embarrassed, or what we use the word stigma. They feel that they can't tell people about their problems. They feel ashamed that they have a memory problem. And they recognize that other people are scared to even talk with them. Now, at one level, this seems surprising. I mean, most of us are caring people. And it's hard to believe that 75 years ago, most doctors thought you should not tell a person who had cancer that they had that disease. Today, that's inconceivable. But that was not just doctors and nurses, but that was society's attitude. Don't talk about it. Today, we recognize that the opposite is true, that the more we can engage people in their own health and the more we can support them, not just in talking about it, but also doing what can be done to help them, the better everybody comes out. And that really is true for dementia and Alzheimer's disease as well. And I think having dementia-friendly communities, so dementia-friendly Baltimore County in this case, is really important. So to finish up, what are some of the things that we all can do to maximize the quality of life of people with dementia and our relationship with them? So programs like this sit in a kind of a context where we realize that being natural, just talking with people, engaging them in conversation, that in itself is a big step. Okay, many of us have to overcome our own fear. Will we say something wrong? Will we do something to upset the person or embarrass them? This is true today when you talk with someone who has a friend or loved one with cancer. There's some people are so afraid of saying the wrong thing that they withdraw from the situation, only to learn that if they're just themselves and they interact with the person the way they always have, that's what the person with the illness craves. So that's one thing, be natural. Second, be aware that sometimes when we talk with people who seem to be having problems, we raise our voice. It's like when you talk with someone whose primary language is not your own, it's just natural to feel like if you talk more slowly and loudly, that somehow they'll understand it better. And it's a natural tendency that we have to try to avoid here. Like with everything, maintain good eye contact. I mean, it's just natural, but that cements our relationship with people. And use the person's response as a guide. Many people with Alzheimer's disease have absolutely normal ability to engage in a conversation. But there are some individuals with the disease who have trouble producing words or trouble understanding us. And you quickly come to appreciate that. And so use their responses as a guide to engage them. This is no different than giving people a cane, a walker, or a wheelchair if that's going to help them function maximally, that is, get around even though their walking is impaired. So it's the very same principle that we use in helping all people who are chronically ill. But here it's maximizing their ability to interact with other people, to get around in the world, to feel welcome. And I think this program is so important because for people who struggle with doing that, and I'm talking not the person with the illness, but those of us who don't have dementia, we can learn how to do this. And Dementia Friendly Baltimore County is going to help train people, not just police officers and other people who work in that public sector, but bankers and storekeepers, and those of us just in the community at large, how to be comfortable in interacting with people. And this is how we're going to help overcome the isolation and loneliness that many people with dementia experience. So again, thank you for inviting me. And I think we're going to actually have 15 minutes for questions. Is that right, Jane?
We do have questions, and if you want to put a question in the chat room or let me know if you'd like to unmute yourself, gladly do that. I'm going to start off with a question and then hopefully we can look in some of the chat questions that we have. But I would ask you, Dr. Ravens, if you had a magic wand to wave over Baltimore County, what are some things that you feel would really make an impact in some of the services that we have or businesses that are around? You talked a little bit about communication and the support of them, but what are some things that you see that may be really relevant for us changing or encouraging businesses or associations to change with us to help in this movement?
Well, Jane, I think the first thing is just to get people talking about this with each other, get it out in the open. Again, it's like cancer 75 years ago. It was such a hidden topic, such a scary thing to talk about. Nobody discussed it. And of course, that was harmful to everyone. And I think once we get businesses and individuals talking about it, I think many people will recognize that they're afraid, they don't know what to do, what to say, that other people have the same fears, and that they can learn that those fears are unfounded. So you say the wrong thing and someone gets upset or they don't understand you. Well, this happens all the time in business and in life, and we adapt. So I think just getting it out in the open and getting people to talk about it is a really important first step. And so it's less although our teaching people is important, I think that's less important than just getting people to recognize that this is part of life, and these are people with dementia are like all of us. They crave conversation and interaction.
Well, thank you for that. We have a couple questions and comments in the chat room. One is a question in regards to respite care, and how do you feel that impacts caregivers and services that are available? And I'm not sure if you have the information. I know Baltimore County has a caregiver coordinator and respite care person, I believe, Laura. But any insight to that for caregivers?
Sure. Well, I think first, in talking with many caregivers over my career, I've heard the statement, no one can help my husband or care for my wife or my sister as well as I can. And so every time I have somebody come in and help, bad things happen. And at one level, that may well be true. Often, because it's a loved one, you do know the person better than anyone else. But what respite does, what relief, even for a few hours, does is helps people refresh, to remain available, and to maintain their own well-being and health. So I think respite, meaning just brief relief from caregiving, again, whether it's a few hours or it's a scheduled thing a few times a week, or it's 1 week, or a few days that a person can get away from the situation, I think is an incredible resource. And I would really encourage people, particularly anyone who's the primary caregiver and doesn't have anyone else available to help, to contact the county, the Agency on Aging, and find out what services are available. I think respite is incredibly important, not just for the caregiver, it's important for the person receiving care. We want to help the caregiver remain physically and psychologically healthy, and I think respite helps do that.
Helps recharge that battery, so to speak.
Absolutely, that's a great way to say it.
Absolutely. Someone brings up a question about how do you get a group? She has a knitting group that she takes her mom with her who has vascular dementia. What are some tips to give them in regards to communicating? I think you certainly mentioned some of those in your discussion. How can she enlighten the group to include and not, kind of disregard her mom in regards to communicating and conversation?
And I would say not embarrass her mom. And so how do you, this is a specific kind of situation where I think trying to touch base with people out of the situation of the knitting group, meaning not when her mom is there, again, to open up to say, gee, I don't know how comfortable people feel with my mother, and I'd love to hear if it's making people nervous or worried, and or if you're concerned about not knowing what to do, let's talk about it. So again, opening up the subject, but doing it in a way that respects the person with the disease. Because we don't want to talk about them as if they're in the room, as if they're not there. And we all do that naturally sometimes with kids and sick people. So I think being aware that we want to avoid that. But again, first bringing the topic up and saying, for example, maybe people don't know what to do if my mother forgets something, and say, it's okay to acknowledge it and say, try this stitch, or here, to do something to help the person.
And I think the daughter could be a catalyst also to help engage her in the conversation, to model maybe that conversation engagement, to help then see that, other participants in the group may then feel more comfortable including or kind of watching her engage and then kind of modeling that for them. And then they also then take that lead. I think that too helps.
Yeah, great suggestion.
Stan writes that, do you now speaking, not understand that dementia is a private condition in which caregivers become the patient's interface with the community? For example, if my wife would show up at the bank or dollar store, I would want them to know how she got there since she's forbidden to drive. Caregivers often mediate the dementia patient's interaction with the world. So I think he's asking a little bit about maintaining privacy, but also engaging the community. And Dan, please, Stan, let me know if I'm not saying that correctly.
Yeah, what an important and challenging issue. Many years ago, one husband told me that what he did was he actually had a little card printed up and said, my wife has memory problems, and I'm, but please, talk with her, and I'm available to help, and even had his phone number there. And so what he said is if they went to the bank and his wife started interacting with the person they were talking to, he'd say, "Can I, hand my card to you?" And clue that person in. And to me, that is appropriate because many people don't realize that the person has a problem. One. Number two, they don't want to be rude, so they don't want to ignore the person. And I go back to what you just said about modeling. I think that the caregiver can often try to explain things in a very simple way to the person, or start a conversation where it's a three-way conversation can help. But I agree that part of preserving someone's dignity is respecting their privacy. And I don't think people should feel, well, everyone has to know that you have dementia any more than everyone has to know that you have cancer or any other medical or psychological problem. I think the closer you are with people, the more likely you might want to share that information. Often they've noticed that there's a problem if there's frequent interactions anyways. But recognizing that part of preserving dignity is privacy, I think is also appropriate. So it is a fine line, but I think if you're sensitive to it, you can help the person be engaged, but not embarrass them.
And I think too, with our efforts of educating the community too, and this outreach effort will help them become more aware of the sensitivity of the topic as well. So I think all of those things are vital. Someone asked if you have any suggestions about adjustment to moving their mother. They're moving her in with them, and just wondering about adjustments to new surroundings. She'll need to use a different kind of phone and TV, and any thoughts on that in regards to facilitating that move?
Yeah, I would say first, moving is hard for most people. If you look at life stress scales, moving is often pretty high up, excuse me, on any of those scales. But it is particularly difficult for people who have memory problems because learning new things is more challenging for them. One of the things to know about Alzheimer's disease specifically is that the biggest problem and the earliest problem that people have is what's called fact memory. So people have difficulty learning new information like facts, like what's your address, or who's the president, or what's happening in the news. But interestingly enough, what's called motor memory or doing memory, performance memory, that is learning new tasks, is actually relatively preserved in people with Alzheimer's disease. And part of that is finding your way around environments. So although I think you have to pick the right time for someone to move, given all the circumstances, I think often if you have a choice, sooner is better than later, because that means people's memory is more preserved. But to realize that people can still learn new things, particularly to do new things. So often it might take a week or two, but they can learn, where is the bathroom? How do you get to the kitchen? How do you do certain things? So that's one. So repetition, support helps. Number two, don't overwhelm the person with information. If let them be a guide. If they ask questions, try to answer them, but don't feel like you have to tell them everything up front. It's interesting when we train doctors and nurses and social workers, we feel like, oh, we have to have this introductory period where we tell them all the important things that they're going to need to know. And what you realize after 2 or 3 weeks is only a very few of those things got through. So that's true for all of us. It's more challenging here. Again, it's scary and hard for most people to move. I think acknowledging that, not just for them, but saying, I know, Mom, it is hard to move and it's going to take a while for you and all of us to get adjusted, but we're in this together. I'm nervous too. So acknowledge your own feelings. In some ways, Jane, that gets back to what you were saying about modeling, but it's also allowing the person to express their feelings, and not feel like, oh, everything will be okay, fine, mom. Some reassurance is okay, but I think acknowledging that it's hard. I do think the idea of if you can move some familiar things, that does help some people. But I think we often overdo this and feel like we have to move all their furniture, and pictures and all that. And again, be practical, but I think don't feel like you have to do things that are impractical.
And I think sometimes just simple cues, like with pictures, we have found have been helpful, like a picture of a bathroom on the bathroom door so that they realize if they open the door, there's the bathroom. It may be taking a picture of the remote and just having, on off so they know the button to push may help. Look, I have trouble with the new TVs. I can't imagine
Don't we all?
all the technology today. But I think too, becoming familiar with technology that may assist them or may assist you too. Sometimes people have found, you know, uh, Alexa has been found to be helpful and those sorts of things. So trying to engage things that you may find helpful are important. But certainly I think trying to, as Dr. Rabin said, work with them and maybe just provide some support, but also maybe some cueing that may help them through the transition.
I can add one thing, Jane, that you reminded me. A lot of this is trial and error. So let's say you want to try a Alexa or one of those devices. So you try it for a few days. If the person's getting more and more frustrated, well, maybe that's for them, that's not going to work. But also give them time to learn new things. Again, it really takes all of us, particularly with something like a remote, it takes a while, it takes repetition. So it's not a day or two or three or 1 week, it's weeks and maybe even months. So be patient, remind the person, cue them in, as you said. All those things can help the person adapt to a new place.
And the one thing I think too is I tell my caregivers routine, routine, routine. Routine is so important. So integrating that routine in the move too, I think helps facilitate some of that disruption. We have a lot of experts here today too. So if anyone else has ideas, feel free to also chime in. We appreciate your insight. I see Andrea Nelson's here from our Memory Center program. Hi, Andrea. Our next question. So let me make a comment first before I read this question, is that, it's noted that we're seeing growth in people with dementia, and that oftentimes they're undiagnosed or don't know of their diagnosis. The next question relates, though, is that today they feel that the understanding of dementia, that some doctors label someone with Alzheimer's as soon as the person shows signs of memory loss. So I guess it's just a question in regards to assessment of someone with memory loss, and how we can facilitate and promote the most high quality care of assessment.
Yeah, there are a number of aspects to this. And let me say that I actually think this is something we're still learning about. How early should we make a diagnosis? What kind of information do we need very early on to make an accurate diagnosis? I think we still actually don't know all the answers there. We're learning a lot, and that's where studying these questions is so important. It's important first to understand that with normal aging, it does become harder to come up with words and names, and our thinking slows down a little bit. So things come to us a bit more slowly. That's normal aging. Diseases like Alzheimer's disease, people really have significant impairment in learning new information and in doing things that they've always done. So if someone's always paid their taxes, filled out the forms on their own, and now is having trouble, that's a significant change. But if someone never did their taxes and now they're struggling, well, we can't use that as information to make a diagnosis. So there is a real individual personalized element to it. I think when there's a real question, that's when maybe seeing an expert is important if it's a questionable instance, because again, it's getting the right testing done nowadays can help. Many primary care doctors now are being trained to how to make accurate and appropriate diagnoses, but not everyone, and not every neurologist or psychiatrist knows how to do it either, or even geriatrician. So I think when there's a real big question, that's one time to see a specialist. I'm probably more skeptical than most people in the field about making the absolute earliest diagnosis. Again, I think, and the reason is because the treatments that we have right now are not effective really in delaying the disease or dramatically improving how people do. So I think if people are concerned about their memory or if it's affecting their life in any way, absolutely, we want to determine whether it's coming from early dementia, or use the word mild cognitive impairment, or MCI, to describe people with very mild problems. But not all those people develop dementia. Some people are stable for 4 or 5 years, and we don't want to make a diagnosis that ends up causing people to limit what they do when in fact they're not going to get worse. So I think this is something that we're still learning about myself. I think other experts would give very different answers. But I do think when it's in any way impairing someone's life, when their personality is changing, when they're having trouble at work, when their interactions with loved ones, families, friends are problematic, if they're getting lost when they're driving, at that point, we absolutely need to have people evaluated to see if dementia is the cause of it. But if it's really subtle and they're functioning at absolutely the same level they always have, I think we should talk with the person. And at that point, if they want a diagnosis, absolutely pursue it. But if there's no problem at the time, I think we have to be sensitive to their wishes. But again, I'm going to acknowledge that not every expert, and probably the majority of experts, would disagree with that.
Thank you, Dr. Ravens.
Dr. Ravens, hi. Is it okay? Dr. Ravens, my name is Leonisa, and I have a question. I have a very close friend that was diagnosed with vascular dementia. I am not a caregiver, but I really I volunteer, because when I found out that she has Alzheimer's and dementia, for me, I really try to, the whole family works, and for me, I spend few hours with her once a week, and I try to put a calendar and pictures in the bathroom, or I try my best to be kind and talk to her in a nice way, and I don't disagree on everything she said, you know, and I just, for me, I am really trying my best, but as you said, there should be a continuity on how to, you know, you reorient this patient about, you know, disoriented, you orient today is that the day is like this, you know, because I asked her, she was disoriented 3 times to date, the time and the place, and I tried to reorient her just one thing at a time, and she will remember that.
Okay, well, let me answer this. Sorry to interrupt, but I know we don't have much time. I would say, first, the fact that you're seeing her 2 days a week, 2 hours once a week, I think that's wonderful. And I agree with what Jane said before. Scheduling things, regularity is particularly helpful to people with dementia. But of course, that means that there are a number of other days and hours that she's not interacting. And one thing that the family might want to look into are day programs. There are many available in the area. The Department of Aging knows about those resources, and so you're doing what you can, but maybe involving her in a program to keep her active and busy at other times, I think that would be helpful. I think as far as reorienting people, I think sometimes we overemphasize it and other times we ignore it. I think just know, listen, I don't know what today's date is, to be honest, but I'll look at the newspaper as soon as we're done and find out. But if someone's asking a question about it, I absolutely think we want to answer it. I think often we can introduce into our conversation anchoring information about what's going on in the world or the day or whatever. I think yesterday was Pearl Harbor Day. To say, wow, I can't believe that it's 80 years or whatever it is, 81, I'm not sure. I guess 80 years since Pearl Harbor. And every December 7th, I think about it. That maybe that's relevant to a conversation. And again, our purpose in having conversations is to engage the person. It's not really to give them information. So if they are old enough and there are still people around who might remember, where were they when that happened, when they heard that news? That's a conversation that you can have. And that would be a good reason to say it's December 7th. Or, geez, I'm already behind in my Christmas shopping. It's still 2 weeks to Christmas. But I've really got to, I've got to get my list together. That orients people in a way that is not just meaningful, but again, it might engage them in a conversation. Is there anybody they want to make sure that they get a present for and that you could help them with? But I think just to orient people, we've learned, in fact, that often frustrates them. And again, it's not a way of engaging. It's not a way of having a conversation and a meaningful interaction. But the fact that you as a friend are seeing this person regularly and talking with them, I think that's fantastic. That's what this whole program, this Dementia Friendly program, is designed to do. So, thank you for doing that.
And I have another and I have another thing. I am a very I live a healthy living. I eat very, very healthy. So with reading a lot about this dementia and Alzheimer's and all these medications, sometimes they said Alzheimer's is the loss of memory, is the side effects of taking too much medications. And I do believe, personally, food is my medicine. And once I see this friend of mine drinking a lot of soda, which is full of sugar, I don't think I have the right, if I'm with her, I really don't let her drink soda. But that's why I said there's no continuity. My purpose is to have a continuity of care, but
Okay.
I cannot do
And
that.
let me interrupt you again. First, you're her friend. Her family's got different responsibilities. So, but the other thing you mentioned, and I don't know, Jane, if I have one more minute, but probably a lot of people have questions about prevention. And I don't know if we should touch on that real quickly or if we need to move. Looks like we need to move.
I think we just have a minute left.
Okay. All right. Okay. Thank you very much.
Let me just say this because I think this is on everyone's mind. Again, this is a disease like many cancers where there are things in the environment that trigger cancer, but a lot of cancer, the vast majority of it, is something that's beyond our control, unfortunately. So, of course, we want to encourage people not to smoke. That's a risk factor. But many people who have never smoked still get lung cancer. How about dementia and Alzheimer's specifically? It's the same thing. There are things that we can do to lower our risk, but this is a disease that's been with humankind forever, long before there were the environmental or food issues we have now. So what can we do? We want to make sure that all our vascular risk factors, high blood pressure, being overweight, high cholesterol and abnormal lipids, that those are treated as much as possible. As you mentioned, Leonardo, talk to your doctor and make sure that every medicine you're taking is necessary and is being prescribed at the lowest possible dose. It's not avoiding medicines, it's avoiding unnecessary medications and dosages. Keeping physically and mentally active does seem to benefit and either delay or lessen the impact of dementia. I think that's still an important question, but I really encourage people to be socially and physically active. The CDC recommends 30 minutes of physical activity 5 days a week. I think that's a great recommendation. So again, there's a lot about prevention, but I think those are the main risk factors. And I guess the only other one I would add would be there is some evidence that a so-called Mediterranean diet where you eat less red meat and more fruits, vegetables, use olive oil instead of other fats, has some benefits and may be some slightly preventive.
Thank you, Dr. Ravens. Thank you.
Thank you. Thank you very much.
There are questions that unfortunately we aren't able to get to. If you'd like to, you can certainly follow up with me and I can connect with Dr. Ravens. My email is jmarks, marks, @jhmi.edu, and I'll put it in the chat box. I'd like to thank Dr. Ravens for his presentation and talk, as well as answering all these great questions. And I know there's still so many to answer, but I'd just like to end to say that our initiative here is engaging the community. So certainly we appreciate the police department and fire department being on board, especially as we come out of the pandemic, realizing the important role they play in working with our older adults, especially those with dementia. And we appreciate everyone's support in getting the community engaged and looking at Emily's work that she's doing. We appreciate this so much. So thanks everyone as we continue the program.
Hi, this is Michelle Mills, Division Chief for Baltimore County Department of Aging, Individual and Family Services. Again, thank you, Dr. Ravens. Thank you, Jane. This was a great way to kick off our event today. We have a lot more to come, so I want to keep us moving along. And at this time, I'd like to introduce Emily Kearns, who you guys have heard about. Emily is our Dementia Friendly Coordinator who has joined our team to help us become a Baltimore Friendly Dementia Friendly Baltimore County. Emily has been instrumental in developing the Dementia Friendly program for the state of Massachusetts. This was accomplished through program management, development of the statewide strategic plan, and she has 10 years of experience in developing programs and services for the older adult population, especially as it relates to those living with dementia and their caregivers. So I'm going to turn this over to Emily so we can see what's next in the process. Thank you.
Thank you, Michelle. It's an honor and a delight to be here. And thank you everyone for joining us today and for engaging. Thank you, Dr. Ravens. Your presentation, your conversation, and your answers were really impactful. So at this point, we're going to pivot. What's really important in this type of program is to not forget what we're doing. We're really supporting folks living with dementia and their care partners. And so they are front and center. So in taking a page from the disabilities movement, a lot of the dementia advocates are saying, you know, nothing about me without me. Please have us at your table for your planning, your strategy development, your conversations about programming. So how do we do that today? I've invited two dear friends who are on the dementia journey, a woman living with dementia and her care partner, to join us via video. So for the next few minutes, we will be listening deeply, and I ask you to turn up your sound to the maximum volume because Cindy's voice is very soft. And we want to place them front and center today and hold them as the guiding compass for all that we're talking about, all that we're doing, because that is the end to which we're moving, toward which we're moving, is supporting folks living with dementia, their care partners, because as the old, adage says is now that it does take a village. So we're going to stop and watch this video, and then we'll speak a little bit about how the Dementia Friendly model, which is a national model, actually responds to some of the issues that they bring up, that they're experiencing, and also that you brought up in your questions and conversation with Dr. Ravens.
It's me.
Thank you for your patience while we load the video.
Dementia has what they have call an insidious onset. It's really hard to point to a specific time back in the beginning where all of a sudden I was aware that there was some kind of mental problem with Cindy. And actually, we probably talked about it, but I can't remember anymore, except that finally we decided to see a neurologist. But it was a ways into this, at least a year, I would think, before we did that. Does that sound right?
Actually, I thought that we decided to see the doctor.
Okay. Yeah, we decided together, right? I mean, you decided too. Is that what you mean? Yeah.
Mhm. But it was a drawn out experience getting
Mhm.
to meet with the doctor.
Mhm.
They were all signed up. Everybody had more than the patients they could deal with, and so it was for the good help that we have finally gotten. I am appreciative, and we need to spend more money in this field, or
Yeah.
so.
Yeah. So we saw a neurologist who administered a short evaluation type test with you while I was in the room, and then proceeded to say that you have mild cognitive impairment. So this was about maybe a year and a half ago or something like that, not all that long. And so she said, okay, you're not doing any driving. Of course, you'd already stopped driving anyway, I think, pretty much, right?
It was clear that I didn't belong behind the wheel anymore. That's a big changer.
But since we're both retired, there wasn't a huge problem for us to address. You know, we're both retired. We've been retired for about 10 years.
Well, maybe
So,
it was more for me, not having access or not wanting to drive.
yeah.
Yeah, I just remember moments of, well, book group is meeting tonight. I don't think I'm going to go. I can't really remember much about the book. And I really don't know why I'm having so much trouble. This is a pretty basic book here. And I had plenty of time, but I didn't get to it. And there was the end of Cindy at the book group after 25 years. Yeah.
Yeah. And Lawrence Community Works.
I had spent several years on the board at Lawrence Community Works. And it was one of the most satisfying work or learning that I had ever had. Toward the end of the June meeting, I realized that I couldn't just take the paper with the minutes on it. I couldn't read it. I didn't understand it. I had no idea what they were talking about. And I had a very sympathetic
executive director.
executive director,
Mhm.
and she gently guided my leaving the organization. She did it so gracefully, and of course I didn't know what was going on, but I just knew I wasn't going to help to anybody. Needed something more than love here, you know.
You know, you've been able to rally, and you've made some changes. You've moved and to join your family or be near your family. But do you want to talk about some of the strengths and resources that you've mustered and discovered?
Well, maybe this will be a little roughshod here, but I think moving closer to be with my family, the fact that we decided to make it the most important goal in our life.
Mm-hmm.
And then something happened where our house, the one we had been planning, when we had just bought, was nowhere ready for habitation. It was just a complete mess. And here we were, I, an army brat that really didn't want to be undergoing any more changes in life. And I was feeling really sorry for ourselves and not sure I really wanted to live in this neighborhood. And there were so many questions I had, and but we went ahead, and we are still without a house, but we are not homeless. We live in my daughter's house, and that is a remarkable experience. There are twins, okay, and a lot of family work goes into being together, sharing responsibilities, laughing a lot. So I'm happy about that. Watching people in our group, in our Tuesday group, monthly group,
Mm-hmm. Mm-hmm.
They are an inspiration. They are an inspiration. Watching them, watching to see how they adjust to the daily, maybe disappointments or worries or
Yeah, and also I found that after we moved, which was about a year ago now,
Mm-hmm.
we have this little neighborhood. We're not, out in the woods, but right in Woodstock Village. And so we have neighbors basically who we immediately met in
Mm-hmm.
a short period of time,
Yeah.
especially as winter set in and we were all out shoveling. And so over the course of time, I started talking to them about Cindy's condition and things like that, because I needed some kind of outlet also as a
Mm-hmm.
caregiver. And so that's been a big resource. And also I noticed that one of our neighbors said, what is going on with your wife?
Mm-hmm.
So it became obvious to me that we couldn't just operate as if everything was normal and people would not notice anything
Mm-hmm.
also. So I needed to adjust, my ideas about how we were going to operate in the world and not try to pretend that we're something that we're not. Also, it turns out that Woodstock has a terrific senior center with a caregiver support group that was ongoing for several years before we moved there.
Great.
And that's been a big help to me also. So I've been attending that. And so
Wonderful.
No, those are some of the resources that I've been able to use.
Yeah, what would be helpful? You talk about the support group, yes, and your families. And what more could we do to become dementia friendly? I mean, that's the term they're using, but what it really means is to become more aware of dementia and supportive of dementia, and bring about more resources so that you can feel more better held, valued, and have meaningful engagement. So what are some of your thoughts?
I remember the first time I went to a major hospital
Mm-hmm.
in the area,
Yep.
and I was at the stage of my dementia that I was forgetting a lot of words, and only slightly better now. So anyway, we walked from the David and I walked from the
Parking lot.
to the main door of the
Yeah.
hospital, and the man at the door, the guard at the door, said, "Who's the patient?" or blocked David's way from coming in. Well, at this point, I was pretty nervous about being without him, because what we were about to talk about was complicated and sad,
Mm-hmm.
confusing.
Mm-hmm.
And he said, "Well, we'll get somebody to come get your husband after a while, after he's completed part of the testing or something, or you've completed it."
Mm-hmm.
So we walked to another door, yet another gateway, and there was a flurry behind the counter. He does all the talking, or they're not talking. I don't know. It wasn't very satisfactory. I knew that they were doing the best they could, but they needed more training to work with people with dementia.
So the hospital needed more training right from the get-go. It sounds like right from the time you crossed that threshold.
Yeah.
Sounds like you were already nervous and anxious, and then they were going to separate you from David, and
That happened.
that sounds scary. Yeah,
One or two meetings,
a couple meetings.
and that's it. And then after that, David was shown, welcomed.
It's like I had to be authorized, but in the beginning, the policy was no visitors.
Ah, I see. Yep.
So only the patient was supposed to go in.
Yep.
Well, see, creating a policy like that is totally forgetting about people who need assistance.
Yes. Yes.
And this is a hospital that has a huge component of, geriatric services.
In the dementia friendly model, the idea is for every touch point, every threshold we cross, Cindy, every door we go into, that the person on the other side is aware of dementia, is aware of this invisible challenge that we're living with and sensitized to it. So the hospital is definitely, obviously, one of those touch points. Senior centers are another touch point. In the model, banks, restaurants, even trying to park our cars with apps now, our other touch points, libraries, of course, faith communities also, in this picture of the dementia friendly community, parks and recreation, schools, whatever threshold we cross, either physical or metaphorically, on the other side, we're received as whole people living with, sometimes not manifest, sometimes not obvious challenges, and that there's sensitivity to that. And to your point, David, we're authorized without policy, but with human dignity, right? To be received and supported is the end goal, the end game for this. So that's a wonderful, really concrete example. And I'm sorry you had that experience. At the same time, sharing it, I'm so grateful for you sharing it, because it's really specific, and you said training, is all that would be needed really there. Yeah.
Well, in the material that has been given me to learn more about this condition, and there are cards that people can given to people to give to others that will increase their understanding of dementia? Do you have one?
Yeah, we're talking about the, recently we saw another neurologist who more specifically diagnosed Cindy with Lewy body
Okay.
dementia. And with that comes a high sensitivity to certain kinds of psychotic or psychotropic medications so there's a card that goes along with that you're thinking of, I think.
Mm-hmm.
Very good. So there's a card that can help sensitize folks at these different touch points
Right.
to your needs. Yeah. So that's really one specific mechanism that we can use for
Right.
communicating, right, with one another. Without a lot, without any major to do or stigma, in the communication, a real simple communication skill and tool, a simple card. So that's helpful. Do you have other ideas for other places, other touch points in your community where you'd like to see, you've had a challenge, or just even envisioning this more dementia supportive community? Is there another touch point that you'd like to mention, that you'd like to see become more aware and have some kind of training or skill to support you?
Well, there's one example I'm thinking of is a medical provider that we were using, that Cindy used for cataract surgery.
Mm-hmm.
And
Around the same time.
Okay.
yeah, so this was a couple months ago.
Yeah.
And we went back for a reevaluation, I think.
Mm-hmm.
And Cindy had not had a very good time during the surgery, to say the least. But so we were sitting now in a conference room with the physician.
Mm-hmm.
And as he started to talk, Cindy was at one end of the room and I was at the other. He totally swiveled his chair and basically started talking to me
Yes.
and addressing Cindy as she, as if she wasn't even there.
Mm-hmm.
So that's an education thing too. And he's a physician. I mean, he's
Yes.
taking care of people. He's taking care of older people, usually, who have cataracts. So that really struck me.
What would you say in closing to the group?
Listen with sympathy. Join the group. You will learn about yourself, and you'll learn more about how to help others.
Yeah, educate yourselves so that you know more about what you're dealing with, what some of the manifestations are, and and so that you're prepared, basically, to know how to talk to and deal with somebody at where they are.
And find people like Emily and our group leaders
Mm-hmm.
that have had the experience and the desire to help.
Well, I want to thank Cindy and David Cook for their sharing of their lived experience. And again, keeping that front and center as we move along. And I apologize for the softness of her voice in the audio, but thank you for bearing with us and using the closed caption for that part, but also going forward. So now we're going to talk a little bit about the model, but you already were introduced to it organically through our conversation, which is great. I'm going to share my screen just for a few minutes, and then we are going to hear from some of our partners who are bringing this model alive, actually giving us examples from the Parks and Recreation, from the library, the Alzheimer's Association, from faith communities. So bear with us as we continue on in a really varied program. So let me share my screen. Great. Can you see that? Michelle, can you give a thumbs up if you can see it? Awesome. Thank you. Great. So we have this exuberant person in the corner, and I want to say that that represents all of us, including folks living with dementia. There's a lot of elements that we can't see until we show up and slow down. And I think that's one of the blessings of this film or the video clip, is that we had to really listen intently. As someone said yesterday in my training, with our third ear, you know, we have to slow down and listen, and so we can see the individual fully. But welcome to the Dementia Friendly Baltimore County, and I want to say that we are part of a national movement. So this model is actually part of a national model that's being replicated across the country in different communities. And as I was introduced, as Michelle said, I was fortunate enough to be involved in the Dementia Friendly Massachusetts movement and initiative, but each one has its own personality, own dynamic, because of course it's driven by the community. So here in Baltimore County, ours will be similar in some of the model elements, but it will have its own personality because of you all who will help it take shape. Let me just go to the next slide, click on this to move it. Here we go. So this is actually from the national model. This picture, you'll see it almost everywhere. But here we have this exuberant individual in the middle. So I want to go back to David and Cindy Cook and the touch points that they talked about. They gave the example of going to the hospital, going back to the eye doctor. She talked about her book club. She talked about having to have left her job. Here is an individual in the middle of the community, and you see all the different touch points represented by these images. You have a faith community, you have city hall, the local government, you have a park in the middle, you have transportation, you have a bank. The idea is that the person in the middle and their care team, their care partners, families, friends, neighbors are really held and supported, you know, in the middle of this community. It does take a village that at every threshold, as we spoke about with Cindy and David, that they cross, they are welcomed by someone who is aware that they may actually have an invisible challenge. We do this quite well with children with autism and other abilities and challenges. And the question is, you know, why can't we do it with older folks? We can. And this model is helping raise awareness and give specific trainings so that in Cindy's case, the next time she goes to the hospital or someone else with living with memory challenges, cognitive challenges, they can be received a little bit more friendly and more specifically with training, right? They don't need to be separated, for example. All right, what does a dementia-friendly community look like? More specifically, these are some of the goals to help folks living with dementia feel included and supported in the places they work, the places they live, the places they play. And yes, play is important. As Dr. Raven said, you know, we have to keep our bodies fit. So in our parks and recreations, in our gyms. The second point is to focus on stigma reduction, reducing fear, and doing that by, as Dr. Raven says, bringing it out into the open, making it part of a normal conversation. Third point is to make sure that folks living with dementia feel supported, as I said, at every touch point, including post offices, retail outlets, transportation, and places where they enjoy their hobbies. And finally, I want to say here that the community can mean a location like a neighborhood or city, but it can also mean a group. And you heard Cindy talk about her book group. And you also heard earlier, I think it was Marge asked the question about her knitting group. So these are really important places where we need to raise awareness and also make sure that folks can still participate. You know, faith communities are another point where folks find such meaning and support. And oftentimes folks living with dementia feel like they have to stop because they're embarrassed because they can't follow the service. So Dementia Friendly America that we're part of has a 4-stage model, and I invite you to participate in this model. The first part is convening a leadership team, and you are all most welcome at the table. And I'll talk a little bit about that the first meeting. We want it to be diverse culturally. We want front and center it to be guided by persons living with dementia and their care partners, as I said, keeping us real and being our advisors and our action leaders. The second phase is to engage in grassroots, community-based, real meaningful activity. Part of this also is to analyze in an ongoing way, are we meeting the needs of folks? Are there resources that we can leverage that haven't been tapped? Also, how can we attract new resources? Always, of course, is the acting, having events like these that are informative, training, also highlighting some of the resources and the partnerships. And we can only do this if you come to the table and let us know what's working well for you in your communities, what's not, and also where are the hidden gems, the hidden resources in your own backyard that you can bring to the table. There are resources to help us, and this is one of the benefits of being part of this national movement. Dementia Friendly America has sector guides. These are actually guides that help you start where you stand. So if you're a member of a faith community and you want to start there, opening a conversation, there's actually a guide for you on their website, Dementia Friendly America. So if you simply email or call me, I can show you how to find these resources. There's also an online portal support where you can meet other folks from other communities around the nation. So we don't have to reinvent the wheel. That's the really good news. We can leverage what's already been done and learn from their challenges. You can become a dementia friend. The first Tuesday of every month, we have a free virtual program for 1 hour. You can also go online. Dementia Friends is the cornerstone of this national and international movement. And this is to raise awareness across all sectors as well, and also all ages. Even children can participate in the Dementia Friends and become a dementia friend and learn what the signs and symptoms are of dementia, and also some basic communication skills. Not finally, but additionally, Dementia Friendly America provides us with technical support. So Baltimore County is squarely now a member, and we can call on them to give us a technical advice throughout our course as this unfolds. So the next step that I invite you to is on January 13th from 1 to noon, we will have a virtual meeting, and you'll receive a follow-up email after this event with more details. But you're all welcome, and I know that you can make a difference by coming to the table to this event, asking us or telling us what your concerns are, but also your interests. Where's your energy? Because that's where we'll start. So I'll stop sharing my screen here, and now we will go to the next step in our agenda. We will hear from our community partners. I say we're already well on our way because our community partners have stepped up, and I know that the rest of you will join us too as you can. Let me stop sharing this. Okay, great. We will begin the community partners session, and it's kind of popcorn style, very short, brief infomercials, so you get a sense of who's with us, who's already at the table, and again, a continuing invitation for you to join us. We'll start with the library with Julie. Julie, are you here?
I am. Hi, Emily. Thank you so much. Hi, everyone. My name is Julie Brophy. I'm the Adult and Community Engagement Manager at Baltimore County Public Library. And at Baltimore County Public Library, we look for opportunities for all our residents to explore, learn, create, and connect. That's our mission, with the ultimate goal of supporting transformation for individuals and for our community. And that support includes individuals with memory issues and their care partners. And whether it's hosting presentations by authors, because we are a library, so authors like Tia Powell, who wrote Dementia Reimagined, Building a Life of Joy and Dignity from Beginning to End, or Jason Karlawish, who wrote The Problem of Alzheimer's, How Science, Culture, and Politics Turned a Rare Disease into a Crisis and What We Can Do About It. From author visits to library-led programs like Brain Games and other events that library staff offer when we would in person at our senior centers and in our retirement communities, the library is committed to supporting our whole community. So we were thrilled to be the host of the first Dementia Friendly Baltimore County virtual informational program last April, and we look forward to hosting more targeted programming in the future, both virtually and in person, including, fingers crossed, creating a memory cafe or meetup in person at least one of our locations. So beyond programming, the library is looking forward to working with this group, the Dementia Friendly Baltimore County, to provide staff training on better interacting with individuals with memory issues and their care partners. Touching on those touch points that we heard about, it was in that very powerful conversation. We want to better serve our community members, all of our community members. And so as you may know, in addition to serving customers at our 19 branches, we have bookmobiles that visit our more than 50 senior communities every month. And our staff interact with individuals with memory issues every day, and we want staff to have the tools so that everyone who comes into the library continues to have positive interactions with all our customers. And so one other thing I'd like to kind of mention to you, preview sort of, is that coming in the spring, we'll have an addition to our Library of Things collection, memory kits. So these are going to be collections of items and activities centered around like a place or a time or a theme that can trigger memories and provide a bridge for care partners and loved ones to communicate and connect. And they'll be available to check out with your Baltimore County Public Library card, of course, but they'll be available. So keep an eye on our website at bcpl.info for more information about the memory kits coming again sometime in the spring. Supply chain issues make it a little iffy about specifically when, but sometime in the spring. And you can, of course, find out about more of our upcoming programs and services around this topic at bcpl.info. So I'd just like to wrap up by thanking the staff at the Department of Aging, particularly Emily Kearns, for the invitation to participate and for reaching out. We want to offer as much support for this initiative as we possibly can. So on behalf of Baltimore County Public Library, we look forward to continuing to work together to support our residents as they move through all the stages of life. So thank you very much. I'm looking forward to hearing from everyone else.
Thank you very much, Julie. Bravo, wonderful. Memory kits sound very exciting, so thank you. If you could put in your in the chat room your contact information, that would be wonderful. So next up, the Parks and Recreation and Nature Programs. So let's start with Professor Marlene Riley. Marlene, are you with us?
Hi, everyone. So I'm Marlene Riley, and I teach in the occupational therapy program at Towson University. And in August 2019, just a little over 2 years ago, our College of Health Professions actually hosted the age-friendly launch here on campus. So this is a little bit different of a launch, but excited nonetheless to be involved with that. This particular semester, we worked with Emily and the Baltimore County Recreation and Parks to host a weekly friendly forest meetup at Cromwell Valley Park and involve the students, and feel that we really created a welcoming environment to hopefully get more caregivers to participate and to realize that they can come with the person that they care for. And then the other thing that we did was, as part of Age Friendly, we had initiated a business outreach, and now we're rolling in Dementia Friendly, and we've laid out some preliminary sort of assessment checklists, educational training for local restaurants and grocery stores, salons, just, you know, giving itineraries to caregivers. This is a place we've already looked at everything for you. You know, here's a sample menu, making those outings a little bit more dementia friendly as well. And then also on campus, we have an Institute of Wellbeing where we have our own memory cafe. One of our other faculty members, Dr. Littleton, initiated that last year as well. So we look forward to continuing involvement and, you know, offering all the student resources and the resources of our College of Health Professions that we get.
Thank you, Professor Riley. It's wonderful. And it's been a real honor actually to see that you and the students at work at Cromwell. Their programs have been great, including music and the forest bathing and other things. So wonderful. Thank you. Allison, are you here? Allison Killen.
Here, yes. Can everyone hear me?
Yes, we can hear you. Great.
Perfect. Okay, so hi, I'm Allison. I'm from Tomar. I'm an activities leader there. And if you don't know, Tomar is a nonprofit farm dedicated to enhancing health for people of all ages and abilities. So Birds and More in particular was created to provide dementia-friendly nature programming. So in the next picture, we have from our first session in August. So participants could choose to engage in a guided bird walk or decorate window clings to prevent window strikes during migration and create pinecone bird feeders you can see in the right-hand corner. So then The next session we had was October, so that had a bit of a Halloween theme in which we engaged in all things owls. So you can see on the left-hand side, we have owls that we made of natural materials. There was some leftover cardboard, but also acorns, milkweed pods, pine cones, so an inexpensive activity. We also played owl-oriented games, so owl or not an owl, and we listened to different nighttime animal sounds and got to have a pretty playful game interacting with that. So then for the next month, we moved into our heated greenhouse for November, and here you can see that we decorated some pre-made salt dough ornaments. We also discussed new arrivals to the area. Those birds on the left-hand side are birds that we can kind of celebrate in November that come and visit us during that time. And also we played Jenga, brought by one of our lovely participants. So the most recent group attracted 7 participants and all stated that they were interested in coming to our next group. So again, it's Tomar is the farm. So the group overall has maintained a loose theme of nature as a means of having inexpensive leisure and social participation. So at the conclusion of this series, we're going to have a brief survey of our participants so that we can plan for a new series in 2022. And I'll put my email address in the chat for anyone that wants to connect.
Thank you very much. That's wonderful, Allison. And I've also attended some of those and just, really, really enjoyed your work, the way you facilitate. So now we're moving to faith communities, and we have 3 speakers. Again, popcorn style, keeping it short, and but you're seeing that there's just a wealth of resources in our community. So let's start with Sarah. Sarah Shapiro, are you with us?
Yes, thanks so much. So I'm Sarah Shapiro, and I am the social worker for both Bethel Congregation and the Soul Center in Pikesville, and for Beth Israel Congregation in Owings Mills. One of my responsibilities at the Soul Center is to facilitate Caregiver Cafe, a monthly drop-in virtual support group for caregivers. This program, which is free and open to the public, takes place on the 3rd Thursday of the month from 2 to 3:30. Caregiver Cafe features a different guest presenter as part of each monthly session. And last spring, one of my participants introduced me to Emily. And in June, she joined Caregiver Cafe to introduce us all to the Dementia Friendly Baltimore County initiative. The program was very well received. And as a result of that, the clergy and I at Beth Israel, my other congregation, decided to invite Emily to present there as an afternoon session on Yom Kippur. Her Zoom program called Beyond Yom Kippur, Living a Life of Memory Making Every Day, invited congregants to show up and support one another and to choose presencing, the option to slow down and savor moments together. Following the program, clergy received many positive comments and requests for resource information. Clearly, faith communities can play an important role in both spreading the word about dementia-friendly Baltimore County and making congregations more welcoming to those with dementia and their care partners. So I encourage everyone to take advantage of this wonderful resource. Thank you so much.
Thank you, Sarah, very much. It's been a delight to be working together with you and connecting with your communities. Next up, we have Linda Stewart. Linda, are you with us?
Yes, I am. Hello,
Great.
everyone. I'm Linda Stewart. I'm the Caregiver Program Manager at Johns Hopkins Bayview, and I manage the program that we have named Call to Care. And we believe that caregiving is so vital to support our loved ones. And the family caregivers, as we have heard throughout this wonderful forum, are just vital to supporting the care and the well-being and the nurturing of loved ones, neighbors, and friends who are older adults. We started Call to Care about 6 years ago here at Johns Hopkins Bayview, and fortunately, we have been able to support caregivers throughout the Baltimore area. So our mission is to prepare and support individuals caring for older adults with health-related limitations. And how do we do this? We do this through a series of programs and activities. I was so happy to hear Sarah talk about the Caregiver Cafe at Bethel, because that is a program that we started and then others have joined in. So the whole point is to provide warmth, to provide companionship among caregivers, and most of all, provide resources that can make the difference in the caregiving journey. So education and training, we know, is just vital to uplift and edify family caregivers as they're going along the journey, and especially caring for a loved one with dementia. We know it's very complex and things change, but we want you always to know you're not alone. There are many, many others who are also on the journey, and there are many, many other resources. I provide, along with our team, personal consultations because caregiving is so individualized. It's not a one-size-fits-all. And then bringing people together with support groups and caregiver cafes is so vital. I also want to emphasize our outreach in the faith community, because we believe the faith community is so vital to supporting and to building dementia-friendly communities. And I have worked with churches and synagogues to help them develop various activities so that they can reach more caregivers with not only spiritual care, but other resources. So we're doing this in partnership. The next slide shows you the partners that we have worked with over the program, and you can see it's a diverse group of programs, but they all can be very, very vital to supporting family caregivers. So we're here at Johns Hopkins Bayview to support you. We know that this is a time that you need a lot of care for the caregivers. And so our team, which consists of Dr. Hale, Kimberly Monson, we're here to care for you. So thanks so much. And we're looking forward to being a member and a team player in developing more dementia-friendly communities here in Baltimore and Baltimore County.
Thank you very much, Linda. Linda has just been such an important advisor and so generous in connecting with me in my new position, with the community, and your work is so valuable. Thank you again. Next up, we have Kim High. Kim, are you with us?
Yes. Hi, everybody. Thank you, Emily. Again, my name is Kim High, and I'm a colleague here at the Department of Aging of Emily's. And I have also been appointed as the director of the older adult ministry at my church. I was trained as a dementia champion, and through that training, that afforded me the opportunity to provide the Dementia Friends information session to some of the church leadership and to members of the congregation as well. So we are just in the early stages of, increasing the awareness about dementia through the congregation. I'm in the early stages of having some conversations with church leadership and how we can expand our efforts, not just within our church to be more dementia friendly, but expanding that out into the community at large. So that's where we are at this point. Thank you very much.
Thank you, Kim. Kim has been really an important colleague, and I'm so happy, that you're part of the team and that you're doing this great work with your faith community as well as the work here with BCDA. Next, we're going to the mental health group partners. We start with Casey Saylor and then go to Margot Quinlan. They're co-presenting together. Welcome. Casey?
Hi, Emily. Thank you so much. I'm excited to join you today from the Mental Health Association of Maryland, which is a nonprofit organization that's been serving Maryland for over 100 years, dedicated to education and advocacy around mental health and addiction. While some of us experience mental health conditions early in life and live with them for years, others may develop them for the first time in their later years. And many common stressors related to aging can actually put us at risk for developing late onset mental health or addiction issues. And some of those stressors can include something like cognitive impairment or dementia. The availability of supports and interventions to promote healthy aging is super important for helping to reduce these stressors and reduce the incidence of mental health and substance use problems and helping people heal from them when they do occur. So in 2001, MHAMD developed our older adults program, and we focus on widespread education and advocacy around these topics, helping to raise awareness and get the valuable resources to individuals who need them. So one of those programs is our Baltimore County focused Vibrant Aging Peers program, which I oversee. I'm the older adult project manager. And this program focuses on local Baltimore County based education to anyone who wants it. So if you have a church group, if you are a provider in the aging realm or the mental health realm, or maybe you have a book club, we are very happy to help bring information about how the brain works and how you can take care of it, along with any other topics related to mental wellness that you would like. So you are welcome to reach out to me if that's something that you're interested in. We also have a number of publications and fact sheets in that vein. We also have a telephone peer support program where volunteers visit and spend time with older adults in the county to help reduce loneliness, identify those stressors, and promote mental wellness. So that program's been going on for almost 2 years now, and we have been working with Emily for about that period of time, and we have integrated education around cognitive impairment and dementia into our educational programming for the volunteers in that program and our public programming as well to help fight that stigma and raise awareness around the interaction between mental health and dementia. We also promote dementia-friendly programs to our little networks that we have going on. Well, I say little network, it's pretty big, but the peer support programming that we provide all hear about the wonderful programming and resources that Dementia Friendly has going on. And I am very, very much looking forward to taking everything that everyone is sharing today and bringing it back and sharing it with all of our participants so they can share it with their networks and benefit from it as well. So I will pass it on to Margot now after just giving a quick shout out. I'll put my email address in the chat. And you should all go to our website, mdaging.org, and look into our mental health in later life guidebook, which is a great resource, also touches on cognitive impairment as well and taking care of the brain in that capacity. And I really look forward to including information on Dementia Friends in the next rendition of it. That will be a wonderful addition. Go ahead, Margot.
Casey, and thank you, Emily, and everyone who shared. This has been great. I've also just been soaking everything up, but just to expand a little bit, as Casey was saying, at Mental Health Association, we really look at these intersections of mental and health and cognitive health and how are we supporting our wellness in those dimensions. We also, as far as how we organize and operationalize, look at the intersections of systems change along with programmatic supports. And so one of the services that we offer and one of the resources that we convene is the Maryland Coalition on Mental Health and Aging, which is an open coalition space. And we have dozens of members from aging and behavioral health agencies, consumers and community members, family and professional associations, and also, and I think really importantly, government agencies come to the table there. So we have a lot of our local area agencies on aging, folks from the Department of Aging, Department of Behavioral Health. And it's a space for us to come together and share resources, to learn together, to craft policy changes together, and to make sure that our communities are being supported with the resources that we really need, and that the best practices and interventions are getting into our communities. And so if you're into sort of the advocacy or community or sort of policy lean, we would encourage anyone to join us for one of our meetings. I'll drop the information in the chat as well. We're not, I don't think, going to meet again until January, but would love to invite folks to join us and to plug in with that work. And again, thank you for giving us space to join you today. This has been lovely.
Thank you both, Casey and Margot, and I'm glad you're putting the information in the chat room, and I will compile the information for folks. People have been asking and send that out later. So we're moving along. our popcorn infomercial resource sharing with, now we're focusing on creative expressions. So this is really important because we're trying to challenge or counter the dominant narrative around dementia, which is really a tragedy narrative. And as we know, it's really difficult and there is a lot of suffering. At the same time, there are incredible programs, innovative programs like music and memory, time slip storytelling that's supporting the journey with dementia, especially in the middle and early stages. So our partners in the creative expressions will share what they're doing. And then in March, we're having a Living Creatively with Dementia program, which we'll learn more about later. But Loretta, are you here?
I am.
Great, thank you.
Thank you so much. My name is Loretta Vini, and I've been an inspirational speaker since 2014. And in addition to speaking on a variety of dementia and caregiving topics, I also offer Lego events for caregivers and care receivers where they build memories, hope, and joy to help them be inspired along their caregiver journey. And I really believe this is the work that I was born to do. And if you've ever been on my website, and I'll put it in the chat in just a minute, my tagline is, I help caregivers move from I give up to I've got this. And that's always, such a kind of a cool thing that people love. And so my interest in Dementia Friendly Baltimore County, even though I live in Prince George's County, Maryland, involves me working with the Caregivers Conference about creatively building joyful caregiver experiences and creating as many opportunities as possible for caregivers to build some joy with Lego bricks. And I love my partnership with Call to Care and Elder Plus at Johns Hopkins. I've been working with them for several years. And I think I bring some additional knowledge to the table, as well as I am a member of Dementia Friendly America Northern Prince George's County. So I hope to be able to provide some insight and some inspiration along the way. So thank you so much for having me.
Oh, thank you so much for joining and for sharing, Loretta, your gift with us. And I've already participated in your Lego play and I absolutely love it. So I give a shout out to you for that.
Thank you so much.
Yeah, David Felsenberg. David, are you with us?
My name is David Felsenberg, and I am the sole 24/7 caregiver for my wife, Janice, who has Alzheimer's disease. In terms of creative expression, I have been a professional clown, and that's your cue to smile, okay? So I've been a professional clown for many years and have used the art form to interact with people who have dementia. I've been advising the coordinator of the initiative in its early days, connecting her to caregiver support groups and faith communities. I look forward to presenting about the power of humor during the March 30th Living Creatively with Dementia event.
Wonderful. Thank you so much for giving this introduction, David. And I have met David and his partner, his wife, Janice, and they are remarkable persons and key advisors for this initiative. And so look forward to future relationships there working together. Next, we have Karen. Karen, are you with us?
I am. Hello, hello. Thank you, Emily. I'd like to dance till 2 o'clock, or sometimes dance till dawn. My name is Karen Weber, and I'm a peer, Jewish cantor, and teaching artist working with older adults in Baltimore. I conceived of Mona's Hairbrush, the story of Mona, an 80-year-old artist living with dementia. This film brings us back to her childhood terrain of Washington State, the tulips, the rivers, and a hairbrush, which is really a paintbrush. This creative piece is an invitation to peer through her open window and enter Mona's psyche through poetry, song, and visual image. I'm creating this film with my partner, James Wilson, who created a miniature theater with shadow puppets and a proscenium stage. He creates the visual world, I create the auditory one. The narrative is divided into 3 parts. By sections 2 and 3, ideas become more abstract, the dementia more evident. The script gives words to Mona's feelings of loss and hurt, but also great joy. James and I envision Mona's hairbrush to be seen by caregivers, family and friends, at libraries, senior centers, and schools. We look forward to finishing the film soon and showing it often. Or if the band could stand it, just go on and. Thanks.
Karen, you are wonderful. Thank you so much. And we can't wait to see Mona and have you in the March Living Creatively Bold and program. Wonderful. Thank you. Thank you all. Next up, we would like to hear from Joan Marie Twining with the Rose of Sharon Equestrian School. Joan, are you with us?
Yes, good morning. I'm the founder and executive director of Rose of Sharon Equestrian School. We're pretty new to Dementia Friendly Baltimore County, but not to serving residents of the county with dementia. We were heading into our 4th year of providing equine facilitated programming, which means we bring people with dementia to the farm and they work with the horses and miniature horses and ponies. And also their caregivers. We've been working with several local continuing care facilities, Broadmead and Hunt Valley, and Blakehurst and Towson. Some of the results that we've seen from this program have been positive effects on mood, motivation, movement, memory, and meaningful conversation among the participants. We look forward to developing a memory cafe and furthering our outreach through Dementia Friendly Baltimore County. Thank you for the opportunity.
Oh, Joan, thank you. Thank you for being here. Anne Marie and I went to visit the school, to meet Joan, and just so impactful, to see the work that they're doing. And we look forward to future work together, see what we can do programming wise. Next, the neighborhood associations. Again, we're working our way through that image, right, of the village supporting folks living with dementia and care partners. So for the neighborhood associations, Dawn Seastead has done a video, and so we'll listen to the video. This is her presentation for the neighborhood work that she does.
Hi, my name is Dawn Seastead. I'm a home care physical therapist and founder of Agewell Home Design, and I've been working with the geriatric population for over 30 years. I also have firsthand knowledge as a caregiver for my father who had early onset Alzheimer's, my mother with Parkinsonism, and currently my 92-year-old aunt, who fell and fractured her hip last year and began showing signs of cognitive decline while living alone and isolated during the COVID lockdown. I believe that strong communities can help develop an important social network for our older residents. 18 years ago in my Woodlawn neighborhood, we started what is now called the Friends of Larchmont. We meet monthly and host several annual events. And as new people move in, they each receive a welcome basket with baked goods, a neighborhood directory, and resource lists to get connected. As our residents age, they've already forged many connections with people in the community who continue to provide support and friendship through the years. And as younger families move in, they bring new energy, new ideas, and get a sense of belonging to a supportive community. Last year, instead of our annual block party, we organized the painting of a street mural to bring us together and celebrate our strengths. You can see it behind me. It was our first socially distanced gathering since the lockdown began. People of all ages participated, all contributing their artistic talents, some doing their part behind the scenes, and others who assisted residents who had trouble walking to the event. As a bonus, a group of young children joined with our older neighbors to release a cluster of monarch butterflies that had just emerged from their cocoons. The benefits of these connections go beyond our structured events. They're evident as people volunteer to help their neighbors get to doctor's appointments, provide meals for someone who's ill, shovel a walkway, or help with home repairs. In return, our seniors stay connected. They share their life stories, their perspective on current events, and their love of nature. Sometimes it's just enjoying a simple chat over a cup of coffee. My neighbor is our gardening guru, and offers her expertise to the entire neighborhood. She's 87. We take tremendous pride in our neighborhood and have worked hard to look out for one another through the years. We believe a good deed for a single neighbor benefits us all and that everyone has value. Friends of Larchmont is evidence that building a strong community with connections across generational lines is just one more way to help keep our aging population actively engaged with their community and the people around them.
Thank you very much, Dawn. We're really excited. We've just met each other and she told me about her neighborhood association. We started brainstorming to see how they can become engaged in dementia-friendly work. So neighborhood associations are going to be key to this initiative. So last but not least, one of our most important partners, the Alzheimer's Association. We're welcoming Christy. Are you here with us?
Yes. Hi, Emily. Thank you. My name is Christy Morose, and I am a program manager with the Alzheimer's Association of Greater Maryland. We're so grateful to be here today and to support Dementia Friendly Baltimore County as a key partner to our mission. We look forward to collaborating on future events for the community, first of which will be our Living Creatively with Dementia event on March 30th of next year. The Alzheimer's Association is the leading voluntary health organization in Alzheimer's care, support, and research. Some of our resources available include our 24/7 helpline, our early stage programs and services, support groups, medical alert, care consultations, education programs, in addition to many more. We're also the world's largest nonprofit funder of research. And after the federal government, we are the next largest funding source for Alzheimer's and dementia research. We are always seeking volunteers that are interested in getting involved, and we have a number of opportunities available. And if there's one thing that you take away from what I'm sharing with you today, I would love for you all to remember our 24/7 helpline number, which I will put in the chat, as well as my contact information if you should need additional resources. But our 24/7 helpline number is 1-800-272-3900, and our website alz.org/Maryland. And again, thank you for allowing us to be a partner. We're very excited about this initiative and happy to be here today.
Thank you so much, Christy. Wonderful. So thank you all community partners. And again, join us on January 13th. And this group will just expand and keep expanding with all of your resources and your input. I'm turning it over now to the manager of the caregivers program here at BCDA, Anne-Marie Reel. Will be breaking out into rooms and she'll tell you more about that. Anne-Marie.
Hello and welcome everyone. We've heard some moving stories and some great examples of ways Baltimore County can build in supports for those living with dementia and their care partners. Now we'd like to hear from you. And with a high number of people registered, we felt it best to break into groups for discussion. I will go over the discussion questions and the group facilitators will have them as well. We will need someone in each group to take notes and email those notes back to us following the discussion so we can capture all of the details and follow up as needed. The chat room will not be recorded in the breakouts, so if you put something in the chat, we won't be able to get that information back. As the discussion time moves along, you will receive a 5-minute warning when it's time, so you've got that going. And when we are sent to the breakout rooms, you will see a notice on your screen when it's time, and you will need to click Join Now. At the end of your discussion, please wait for the tech team to bring you back into the main room so we don't interrupt the discussion taking place there. Please know that the facilitators are going to be focused on the questions I'm about to give you. I know there were a lot of questions that did not go answered in the chat specific to dementia. That's not what the discussion now is going to be about. It's going to be more focused on the dementia-friendly movement. So these are the questions being put to you, our attendees. What excites you about what you heard today? What would you like to see regarding dementia awareness and supports in your community? What could you do to help with this effort? Some ideas might include becoming a dementia friend, becoming a dementia champion and being able to train other dementia friends, hosting a training for a group, a business, your faith community, your neighborhood association, as you've heard others have said they've done, or support someone living with dementia and their care partner. So I'm going to allow the tech team to do their magic, and when you see the screen signal pop up, please click Join Now.
Yeah, please, they're waiting for, we're waiting for the signal for the breakout rooms. So thank you for your patience. And I also want to say that afterwards we'll come back for final announcements. So if you can stay the course, we end at 12:30, so just half an hour left, and we look forward to hearing from you in the breakout rooms. And we're awaiting the invitation. And as Anne-Marie said, when it arrives, you just click Join Now. They pre-configured the breakout room, so we're just waiting for the invitation. We have a great tech team that's supporting us.
Emily, everybody's been sent their invitation. They just need to click on the Join Now button that's come up on their screen.
Okay, I don't see it on my screen. I have my.
Some of you are set to stay in the main room, but others just need to click on that. Like Emily, you're set to be in the main room.
Okay, very good. So I'll let you take it away. Thank you.
What group are you in?
So Ethel, have all the groups been sent? Am I looking at my main room here?
You are looking at your main room with a few
very
additionals
good.
that need to transfer, but yes, for the most part, you're
Very good, wonderful. So I'll start with the main room then. Thank you so much. Okay, so great. So everyone in this room with me, we're in the main room. Welcome, welcome. Others are in their breakout rooms. So this is our own breakout room, so to speak. And I'm delighted that we're all together. We have my colleague Sharon Rose. Sharon, are you here with us?
Yes, I am.
Okay, wonderful. So Sharon is an amazing, very seasoned and experienced dementia social worker. Actually, Sharon, why don't you introduce yourself? Sharon? Well, Sharon is in the caregivers program with me, and she does consults with folks living with dementia and care partners, focusing an awful lot on respite. There's a respite waiver available, and she walks people through the application process. And so she will be taking notes as we talk in the main room today, and she'll report those notes, back to me as we compile all the findings, from the different breakout groups. And this is a way to have your voices heard because we had such a big registration group. So let me just start with the first one. First question, what excites you about what you heard today? And we have a good sized number, but if you want to unmute, or you could I don't believe we can see the chat in the breakout rooms. Let me just check. But if you want to unmute and share kind of in a popcorn style, sharing, what excites you about what you heard today?
I'll go first, Emily.
Please introduce yourself.
Hi,
Yeah.
I'm
Thank
sorry. My name is Patty Blott. I own Remembering Rose Dementia Care Education, and my goal is to educate the medical community, the healthcare community, the neighborhoods, everyone I can on this disease, and to destigmatize it. And what excites me the most, and I sincerely mean this, Emily, is I was recalling our first conversation, I believe in May or June, and what you were starting to get into, and to see all of the different people who have already embraced Dementia Friendly and are out there doing exactly what's important to me, which is destigmatizing. It's just so exciting. It's so exciting that this has gone so well, and it's going at this speed, and I'm just very excited to be a part of it. I just want to add, I'm also very excited about resources that we learned about today. It is so nice to have them. I'm always gathering them, and to have people that are like-minded, and for instance, I believe Sharon, what I just heard Emily say is that you help people get through the application process for respite. I think that's fantastic. Those are we meet people in the course of our workday that need exactly that help. And it's just nice to know where to go.
Thank you, Patty. Thank you. How about other people? Do you want to weigh in? We can stay with that one question, or we can move to the others. Just let me remind you, the first question is, what excites you about what you heard today? Second one is, what would you like to see regarding dementia awareness and supports in your community? And then the third is, what do you think you can do to help this effort? So you could, popcorn your response to any of those. What's exciting? What more can be done? What interests you? Anyone else who want to unmute and introduce yourself and join in? You're welcome.
Emily, I'm Ben Dubin. What excites me about the program was really listening to the individual partners who have already made a commitment to this friendly program, and the enthusiasm that they've shown for the program, doing really a fantastic job for Baltimore County residents.
Great, thank you. Thank you for that. I mean, it's just a foundational start, but it's everyone. I think because of the demographic press, because dementia is impacting all of us, it's really an important time, historical moment where people need support. There are resources available, and some of them very hidden gems, like I never heard about the equestrian school before. And when I met with them, it was like a 3-hour meeting. It was incredible to hear all that they had done, and on a shoestring, and then to brainstorm about what more could be done once we leverage one another's resources. Yeah. Thanks, Ben. And Ben,
Emily.
let me give a shout out too. Ben has been really an important advisor as well along this way, and very generous in connecting me to people. Go ahead. Was it David? Will you speak?
This is Jim Leitner.
Jim,
Yes.
welcome. Yes.
Thank you. I'm a commissioner on the Baltimore County Commission of Aging, and president of the Seven Oaks Senior Center in the Perry Hall area. I am very excited about what you're doing and what this program is doing, and I look forward to passing the word and disseminating information to the seniors in whom I meet on a daily basis, and lend support to this very, very important effort. And I want to thank you for this conference and for the hard work that you have been doing. Thank you.
Oh, Jim, thank you. Lovely to meet you. And thank you for your affirmation, and also for your, interest and willingness, I guess, to spread the word and to invite others into the fold. And given your position and your leadership role, you have the capacity to do that. So thank you for that generosity of engagement and effort. Yeah. Great. How about other folks? Any other comments, reflections? We don't even have to stay necessarily with these questions, but they're just guiding questions. And those who don't have your video on, I don't know if you want to turn it on for the breakout room just so we can meet you. It would be great because there's a lot of names. It would be wonderful to start to put name to faces. Yeah.
What we didn't hear, Emily, was anything from representatives of our total Baltimore County community. We have I believe, a pretty large Hispanic population.
Yeah, Ben, I missed the first.
Them.
Ben, I'm sorry, I missed the first sentence or two.
We have a pretty large Hispanic population, and I didn't hear anything this morning concerning that population, as well as there are other populations that are represented in Baltimore counties that we need to make sure that we reach everybody regardless of their language.
Yeah, yeah.
Backgrounds.
Absolutely. Thank you for that. That's been front and center, honestly, since I've been here. One of the first things I did was to ask if we could get our main flyer translated, bless you, translated into different languages. And we have it in Russian and Korean and Spanish. And what's really important, Ben, is I know the statistics. You know, the African American communities have twice the prevalence of dementia than the older white communities. The Latinx communities has 1.5 times the prevalence. And so we know it's important to do outreach in diverse communities. What I'm really sensitive to is how we go about doing that and building relationships and bridges. So I'm a white Northern woman, you know, working with this as a coordinator. And what I'm really keen on doing is to building alliances with folks from communities so that from the inside out, you know, they build resources. I can support them, but I don't want to come in as an outsider and say, look, this is what I know about you and your dementia experience. And so that's taken time, Ben. And but I'm very eager, and I've made some inroads with the county, with the community engagement folks. Gabby Slocum, for example, she is in a leadership position, bless you, with the Latinx communities, and they're in transition now. I don't know if you heard, but they are hiring, or I think they've just hired a new community outreach person. So she had a series of meetings at which I was to speak with the Latinx leaders to start this bridge building relationship. And because they just hired someone, she asked me to hold off on that. So it is in process, and it's really one of my innermost values, honestly. And so I hear what you say, and I'm very eager to build those relationships with diverse communities. We are also in the process of hiring, I think 1 or 2, Laura could say more, but Spanish-speaking outreach staff to help in this capacity. One of the things that we've been sensitive about is even though we have translated materials, we also need the capacity in-house to respond when they see the flyer and they call. You know, do we have the Russian speaking, the Korean speaking, not only the language, but the cultural sensitivity, the cultural appropriate response to the person who's knocking on our door. And so we're doing that foundational work, Ben, that I think you're really right, you know, needs to be done. And as one of my mentors said, we have to go slow to go fast. And I feel like that's what I'm finding, is that I get really enthusiastic about the diverse, you know, community outreach. And then I have to slow down because then I realize we have to have the capacity to respond. So Laura, I don't know if you want to say any more, but.
Sure. And good to see you, Ben. Many years of relationships through the Commission on Disability. So nice to see you. Yes, we are in the process of hiring a Spanish-speaking staff and a Korean-speaking staff person to help us with our outreach. Juliana Valencia Banks, I believe, is the new Immigrant Affairs Specialist who was just hired by the county, and we've already had one meeting with her. And as Emily said, and I've been very firm about this, is we can't build it, they will come. We have to really have the infrastructure once we do that outreach, that then we can be responsive to them. So we'll be reaching out through Juliana and through the new staff people that we hire. And we are very much sensitive to those needs. And I just wanted to add that I'm just so energized by seeing a paradigm shift, and that's really what's happening today. I've been aging services for almost 36 years now, and to see the change in attitude, the change in acceptance of dementia in our community. I love Dr. Raven's talk about, shifting the paradigm. It's no different than any other disease that maybe someone is living with in the community. And that whole approach of making sure that people are able to fully participate in their community and to age in place. And I just love seeing the paradigm shift happening here today. And I'm just very energized by it. And Emily, of course, we hired Emily. She was still living in Massachusetts. We were so convinced we needed this lady working for us. She did it virtually for a very long time. And so I thank you all for participating today. I see a lot of our staff on here, and I know they're getting energized by this as well. And I think that all of us are going to really see some great things happen. And I'm just excited about what's already happening. The popcorn, as Emily's been calling it, already shows you that so many people have joined into this partnership and already out there doing it. So that's my 2 cents, and I'll let you go on with the rest of your questions.
Emily, may I make a comment? This is Sharon.
Oh, please, Sharon. Yes.
Yes, I had a little trouble with the audio before. Yes, I just want to, we've used the word respite quite a bit throughout this presentation. And I just wanted everyone to know that Department of Aging and other area aging departments have this caregiver's respite stipend. This year, it's $300. It's supposed to be used for a caregiver, hopefully to hire somebody, a family member, friend, an agency, so they can use the money, because it's so important that they get a break, that they, are able to take care of themselves. There's a lot of stress involved. So we do have this respite fund program, and anybody who's interested, the caregiver would have to call. The individual has to be, in our case, a Baltimore County resident, and talk to our caregivers program, submit a referral, and then I can then follow up with a consultation to assist with the application process, as well as to go over a folder that contains numerous resource options. And I can assist also with applying for some of those programs. So I hope all of you, know about this program and that you will contact, because it is available to you.
Thank you so much, Sharon. I can attest to Sharon's wonderful work. We share a cubicle wall. And actually, yesterday we had a call, which was absolutely brilliant. Sobering, but it was so wonderful in that a neighbor is noticing that her neighbor is not safe, as she said, and went into great detail. Her neighbor lives with dementia. And anyway, I was able to go over to Sharon and sit down with my colleague Sharon and say, Sharon, should we call protective services? Given your experience, how do we respond? And Sharon was just brilliant. So the team here at BCDA, I have to say, is all in. And I want to give a shout out to Laura Riley and the management team, because I've really never been in a AAA where there's so much support for a dementia-friendly grassroots movement. So thank you, Sharon, as a colleague. Thank you, Laura, as the leader.
Thank you.
Yeah. So we have a couple more minutes before we return for wrap-up announcements. Are there any other comments that you want to share, or questions or anything?
Yeah, can I make one more comment, Emily?
Please, Ben. Yes.
For most of you who from the Department of Aging probably know me with my work with the Baltimore County Commission on Disabilities, which I've been vice chair for some 20 years. But my spouse passed away 7 years ago from Alzheimer's, so I've become very active in it. And one thing, there are 2 people on the in this room could address what they're doing with regard to spousal abuse in the area of dementia. It's something where some of our spouses can become very agitated and aggressive. And so is there anything that's being done to address these issues from the county perspective?
Ben, I'm really glad you raised that issue, and I'll ask Laura to respond. But I want to say that just this last week, I received a call from a Vietnam veteran who's caring for his wife, and he told me he lives with serious mental health issues from the war. He lives with depression and also PTSD, and he ended up calling the police recently for himself because he knew that he couldn't hold it together any longer. And we had a really powerful conversation for about an hour. And one of the things I shared with him is our interest in self-care programming with caregivers. And I've done a couple presentations on that, but I'm very eager going forward to do some work around that preventing rather than burnout. And also to your point, Ben, I think, providing skills in de-escalation and diversion. This man was so self-aware because of his work, inner work, and he had a lot of support. I see we're coming back as a whole group. So we'll continue that conversation in a chat or offline. But Ben, I think it's a really, really important issue. And I thought this case embodied, the dire need for that kind of support. So, but we're back together now as a whole group. I'm going to wait just a nanosecond to see if everyone is back before we go on to wrap up and announcements.
While folks are gathering, if you'd like to add into the group chat here anything key about your time together, I've added the email address for those that took notes. If you could please get those notes in an email form back to us, we'd greatly appreciate that. Let me think. Are there any business owners that want their staff to be trained so that their establishment would be considered dementia friendly? There's a question. Are there any community groups that can see now why becoming dementia friendly would allow a care partner and their loved one to feel more welcome to attend, knowing that their situation is understood and supported? Hearing from the faith community was particularly meaningful, and I imagine there are many folks who stopped attending their faith community because of concerns of how their loved one may show up in that space. Did anyone learn of a creative expression today that you're inspired to take back to those you support? Anything like that you'd like to put in the chat? We'd like to see it.
Well, thank you all very much. While you're doing that, I am going to start sharing my screen. And I think, Anne-Marie, you can still look at the chat. Is that correct while I share my screen?
Yes.
Okay, so I am going to go ahead with the announcements. Before I do that, though, I want to thank you all so much for spending the time today. I know you have a very full platter, and it was a great sacrifice to be here. I didn't share with the group, but my parents lived with and passed with dementia, and it changed my life for the better, and that's why I'm here. And so I'm behind you, with you all the way. So let me start sharing my screen for the announcements because there's quite a few and it's easier to follow. Let's see. There we go. Great. Can you see this?
Nope.
Not yet, Emily.
Okay, I have to close out, I guess. I'm not sure why. Hold on, I have to pull up the other one. It looks like only one is coming up.
There we go. Emily, Ethel pulled it up for us, Emily.
Oh, you have the announcements, Ethel?
Yeah.
Yeah.
Okay, so I don't have to do, I'll get out of mine. Okay, great. Thank you. So,
Although Ethel, the screen just went gray. Hold on. There we go.
thank you, Ethel. You're amazing. So again, thank you for joining us today. I want to start by thanking Dr. Rabins. He has offered us a 30% off coupon for any of his books. And that will be in a follow-up email with a lot of other things, but look for that 30% coupon, and there'll be instructions on how you can purchase your books using that. Speaking of books, Dr. Rabins has donated 15 of his books, a mix of his 7th edition of the 36-hour day, and then his newest one, on Alzheimer's, 101 questions, most pressing questions about dementia. And I guess his publisher told me over his tenure of speaking, he collected some of the most interesting and important questions. And now he's published a book so that everyone can, benefit from his answers. So the winners of these books will be selected randomly from the attendee roster, and you will be mailed the books. So also in the follow-up email, there will be a feedback and evaluation form. It only is a 5-minute survey, so we would really benefit greatly from your response. There'll be a Survey Monkey link. You simply click on it and then answer the questions. So again, thank you for your feedback, your input. Let's see, what else? We have 2 save the dates. Yes, great. I can look now at the screen instead of my paper. The first I mentioned earlier, you're all invited on January 13th to a virtual planning and leadership meeting from 11 to noon. If you're interested in learning more about how you might get involved, would be an important first start. You could become involved in the Action Leadership Council, which is really the core leadership group, or in any other capacity that you're interested in. Maybe you want to work with your faith community, your local YMCA, your neighborhood association, your book club. Come to this meeting. You'll learn a little bit more about the model. You'll also meet other folks who are interested. And again, you can see really where your energy is. I always say, let's start where we stand. Wherever our strength is, our resources, our interest is, let's start there. So please join us on January 13th. Going forward, eventually we hope to meet in person. Wouldn't that be lovely? The second announcement, save the date, is a program that's in the hatchery. We are co-sponsoring this, developing it with the Alzheimer's Association and with Johns Hopkins. We're calling it right now, it's a temporary title, Living Creatively with Dementia. And that's Wednesday, March 30th from 10 to 1. And this will be an experiential day full of workshops of different ways to engage creatively together as a care partner with someone living with dementia. So you're both having a great time. Some of these programs that will be introduced are evidence-based, so there's research behind the impact that they have, the positive impact. These will include music, Lego play, you heard Loretta today, enjoying the performance that you heard Karen speak about, Mona's hairbrush. You'll learn about humor and clowning. You heard from David Felsenberg, and more. We'll also have someone, for example, speaking about improv, because improvisation, this is a wonderful technique now where you can build stories spontaneously. You don't have to remember, right? So you can engage together. So join us for these dates. In the meantime, too, if you have any questions, you can, oh, sorry, I forgot about our newsletter. We have a quarterly newsletter. We've just published 2 volumes, 2 issues rather. Please sign up for it by going to our website, the Dementia Friendly Baltimore County website, or you can call us at the number here, 410-887-4724. And at the website too is other information about how you can become involved. Here is my contact information, my email and my phone number. My direct line is 410-887-4751. And I really look forward to connecting with you further. And we're just so blessed and grateful that you've all joined us today. So thank you very much. And that is the end of our session. We look forward to seeing you in the near future. Be well.
Thank you, Emily.
Thank you so much. Wonderful session.
Thank you, Emily.
Thank you all.